there's been reports of people being turned away from hospitals, both private and public hospitals, unless they produce COVID testing results. So to be attended at all these institutions, they are demanding COVID test results. Rapid test results are being disregarded. The reason being that a rapid test is an antibody that looks for antibodies that are made by your immune system in response to a threat such as a specific virus. Rapid testing takes less than 15 minutes but do not diagnose active coronavirus infection. So the general practice is for one to do a rapid testing. Then if there's indication of antibodies or the results are inconclusive, then you are then referred for a PCR testing. Polymerized chain reaction, PCR, is a diagnostic test which shows if you have an active coronavirus infection. It detects the virus genetic material. This is a testing that is currently taking from 5 hours to days for the results to come out. So here's the problem. If you fall sick and you need an emergency attention, you will not be attended to until PCR COVID test results are out, depending on the type of sickness or injury in the case of an accident. Some people might make it, but some will not make it. The results are only coming out after the person has deceased. This is a sad development, and we are hearing chilling stories of how our people are suffering. The main reason for people being turned away from these health institutions appears to be lack of preparedness and the lack of necessary equipment to use. Our health professionals have been complaining about lack of personal protective equipment, PPE, and basic hospital sundries. It then follows that they are not prepared to take the risk of attending to patients without knowing the patient's COVID status and without the necessary PPE. We have seen how health professionals are being heavily affected by the pandemic in other countries, and this has to be addressed. The government, through the Ministry of Health and Child Care, has issued a warning to health institutions, both private and public, condemning the requesting of COVID results before patients are attended. It then boggles the mind, why as a people are we not addressing these issues? We have seen in the last few days how the current situation is affecting even people in high places. It then shows that no one is spared. This can affect you, this can affect me. How can you afford to have a health ministry where we do not have a substantive health minister, with directors having been suspended and CEOs of hospitals fired? How is this possible at this point in time when the country is faced with a pandemic of this magnitude? Leave your comments below and let's hear what you think. Thank you.